share some thoughts on burnout in physiotherapy. Firstly, it's deeply personal and individualized, so take any advice like this with a grain of salt. My first thought is I haven't met many physios where I think it's purely workload. Probably one or two in my career that were working like 7 to 7 shifts and seeing 70 plus patients a week. I think most modern private practices are clued in. They're trying to provide roster flexibility, more sustainable numbers, more one-to-one care. My experience with burnout happened around my 3rd or 4th year, and the word I want to use is intentionality. I stopped being intentional about my physio. I stopped being intentional about my courses, about the structure of my week, about the patients I wanted to see. And I was just kind of going through the motions. Now, this is okay. It's normal. We will all go through the motions in our career, and depending on the seasons of our life, I would say that's relatively normal. But if it happens for an extended period of time, in my experience, that's where I run into physios who are worn out, tired, and exhausted. And the irony was, for me, I developed this C5, C6 pattern of pain, like really neural pain down my neck and down my arm, which was impacting my treating. And I kept trying to treat less and less, but it didn't actually make any difference. And I think because there was a values misalignment and a lack of intentionality. So what I do with my team and the grads I'm helping all around Australia is we map out down to the detail. What would be your ideal roster? Down to, if you start at 8 and work through to 12, how many patients would you see? How many patients do you like to see in a row? Some physios love seeing 6 patients in a row, 8, or doing like 12 back to back. I'm a big advocate for seeing like 6 to 8, then having a rest, seeing another 6 to 8, and I'll land you on a 12 to 14 patient day. And most physios I run into, it's like, oh yeah, that's totally sustainable. Then we talk about what would be your ideal roster and who would be the patients that really challenge you, that you love to see. We make sure we've got a course booked in well into the future, because in the micro, when we're tired, we never really feel like, oh, the way out of this is doing another weekend course. But it really helps to, even if it's just one a year, get that new knowledge, get that top up, be around other people that inspire you. And then I always ask, do you have your next 2 breaks planned? This can be a micro break, like in the next 3 months, do you at least have a 3 or 4 day weekend for yourself? And then maybe 2 or 3 months after that, you have another one, or you have a week off, or you have a 2-week holiday. But having your next 2 breaks planned, there's something in our psychology where we work really well in sprints. So think about sprints as your day, like I only want to see 6 to 7 patients in a row and then have a rest. And then think about sprints with your holidays, like every 2 or 3 months, I've got a 3-day weekend or a week off. When we're intentional and directionally aligned, and the values in the way we want to practice, they're the physios who I see are more motivated, who experience less stress, who experience less burnout. And I've probably only had 1 or 2 physios in my whole working career that have ticked all those boxes and are still burnt out. And that's where we had to go onto a deeper level of care.